Hello everyone and welcome to our first video. First of all, I want to say congratulations to you all. If you clicked on this video, you probably either just finished taking step one or you're starting your rotations in the third year of medical school. And this in and of itself is a great achievement. I just want to say congratulations to you on your accomplishments in school and for clicking on this video, because what I'm about to tell you is gonna change the way you see M3 rotations in the future. So first I want to introduce myself. My name is Joseph. I'm from the CUNY School of Medicine, also known as the Sophie Davis program. It's located in Harlem, New York, and I'm just finishing my fourth rotation of my third year of medical school. So far I've done pediatrics, OBGYN, internal medicine, and family medicine. And I decided to make this video because I feel like I'm just now starting to get the hang of things, and hopefully the knowledge I share with you guys will help you make your choices and help you have a better experience in your third year rotation. And if you have any questions, please feel free to email me at smoothbuttermd@gmail.com, and I'll have the link in the description. So with that, let's get started. So first of all, general tips. What do most people want to know before going into M3? And the answer to that question is probably grading. So you obviously want to get really good grades, but grades in M3 are not the same as M1 and M2. At least for my class, it wasn't, because we were graded on both our performance in real life and our performance on the exam. So how do we balance these two things out so that we're successful in both things and we don't lag behind in either one of them? So for these videos, I want to break them up into kind of things to help you succeed on exams and also things to help you succeed in real life. And if you can do both very well using my tips, you'll be sure to get honors in every single rotation. Well, not sure, but hopefully you'll be able to get honors and it'll help you do that. Okay. So let's start with exam tips. You've probably taken like not a thousand, but like dozens of exams this far in medical school, and you already know the drill. You have to start studying early, but what resources do we use? So my rule is, the only really strict rule you have to go by is to definitely use UWorld. Like every resource that you check, Reddit, if you talk to people, if you talk to residents, if you talk to medical students, they will all tell you that you must use UWorld. It's a must. It has all the information you can ever possibly need to get at least an 85 on the exam. Like if you memorize UWorld completely, I can give you the guarantee that you're going to get at least an 85 on your shelf exam. So UWorld is kind of like the most efficient way to gather all the information you need to know to do well on the exam. And other resources like Anki Step 2 Deck, which you can find on Reddit, Amboss, and textbooks or review books, they're more optional resources that you can use if you are someone that likes textbooks or review books, or you find that UWorld isn't enough for you. I personally use Amboss. I used it before my pediatrics rotation, and it helped me do really well on my shelf exam. So I did it before I did UWorld, and that was kind of like an introduction to UWorld, which helped me get a lot of UWorld questions right. So you can try doing that strategy, or you can just focus on UWorld and do all the questions once and then do your incorrects. And that's like a surefire strategy to do very well on your exam. Also, tips for rotations. Now, how do you succeed in real life? So first of all, I want to tell you guys that we are not seeds. I mean, we are not plants, we are seeds, right? So basically what that means is you're coming into rotations, you're new. Everybody knows you're new. You're not really expected to know, everything right away. You're just a seed waiting to be planted. So what that means is you don't have to try super hard right away to be impressive. There are two main rules that you should definitely follow. I feel like helped me stay motivated when my rotation was going hard. So these two rules are just show up. You'd be surprised like how much you can learn from literally just sitting there, observing, listening, not interrupting people, just watching how residents interact with patients. All these things are going to like teach you so much, and you don't even have to try. You just have to literally sit there and listen and watch. So if you show up, it'll always be impressive. Like especially if you're there on time or even early, and if you leave later than you're supposed to and you're not anxious to leave, just having the mentality that you're there not because you're there from a certain hour to a certain hour, but you're there to get the most out of an experience. is going to get you very far. And it's going to be really impressive to the attendings you work with the residents you work with, because they'll really feel like you're part of the team. Since attendings and residents, they're not bound completely by time. They're, if a patient needs something, they're going to stay there the extra hour or whatever it is. I'm not saying you should stay an extra hour, but if you're doing something useful, like if you're writing a note or you're helping a resident with something, definitely, stay the extra amount of time. This might be like an obvious tip, but, just reminding you guys, like if you're doing something helpful, you should do as much as you can to stick through it and not try to leave early. Also, a lot of you are probably nervous, just as I was before going into your third year. So don't be afraid to try. Like just trying looks so much better than not doing anything at all. So I said before that you just listen and observe. That's great for 90% of your rotation, but 10% of your rotation, you have to try with something. You don't have to, if you're a shy person, you don't have to always be like talking and interacting. If you're naturally like, if you just like kind of sticking to yourself and not going crazy with your interactions with other people, and you're just an introvert, you don't have to become an extrovert suddenly. And what I mean by trying is you just, you write notes, you try to write your notes, you try to give a presentation, or you can ask, if you're not comfortable with doing any of those things, ask a resident, say, can you help me write a note? Can you help me give a presentation? That looks really good on you. And before you know it, you'll actually have the courage to try more effectively and really impress attendings. And yeah, so nobody really expects you to know a lot as a student. If you just say small things, like for example, if you know just small pieces of information. I was doing an AMBOSS question before my pediatrics rotation, and I just so happened to know this one thing the attending asked me about, which is like when infants begin to lose weight instead of gain weight in their first year of life or something like that. And I forgot the answer, but basically I knew that it was within like the first few days, like 5 to 7 days, they're going to lose weight before they start gaining weight. And so something, just a small thing like that from doing a practice question will really be effective. You don't have to know like how to be an expert at diagnosing disease or treating disease. Just small things will really impress your attendings. And one thing to not do is to be annoying. So there's a fine line between being like really annoying and people not wanting to deal with you, and being like a normal annoying med student that's trying to learn. And I can't really teach you exactly how to do that. You have to kind of learn to walk that line by yourself. But here's an example of what I mean, like of how to not be annoying in a situation where you can potentially start to be annoying. So on my first day, I was in the pediatric emergency room, and I was just let into there by the clerkship director. And I had she just introduced me to a resident, and the resident just sat back down and started doing their work, because they're residents, they're working. And I was just sitting there awkwardly waiting for the shift to start, and I had no idea what to do with myself. And so in that kind of situation, you can start like talking to the resident, being super intrusive, but don't do that. It's okay to just sometimes not do anything, just kind of sit back, kind of observe what's going on, ask a few questions here and there, but you don't have to always constantly be doing something, especially in the beginning of your rotations. It's okay to just sit back and learn and not put pressure on yourself. Okay, so how do you choose your clerkships? So if you had anything like it was in my school, when you choose your clerkships, you have a choice between the first 6 for me were pediatrics, OBGYN, internal medicine, family medicine, surgery, and psychiatry. So those are the rotations that I got to choose from in my third year. And I think those are standard across all of the United States, but I'm really not sure. So in my experience, there are certain perks to choosing IM and FM first versus OBGYN and PEDS first, which is the rotations that I went through. And to be honest, it really doesn't matter when you get to maybe your 4th rotation. If you have experienced all 4 of them like me, you'll probably like have a really good understanding of what's going on already. And like at that point, the advantage doesn't matter anymore of choosing one versus the other. However, if you do have IM or FM first, so internal medicine or family medicine, a big advantage that you have is you're going to learn how to write notes, present to attendings, and interview patients from day 1. So the first day you have an opportunity to work with a resident that has patients to take care of, and you can interview them, you can do this, do that, do the other. And this is kind of general medicine. So you're going to be experiencing things that you've been learning for the past 2 years. You're not going to experience like a question about, um, a very OBGYN specific question, most likely on your internal medicine rotation. So you don't have to do any extra crazy studying. Like you'll just be able to kind of get a feel for things from day one. And then going into your future rotations like OBGYN and peds, you'll be able to take those skills that you've learned presenting and writing notes and use them to your advantage to really impress and shine on your really impress your attendings in OBGYN and peds. So a lot of times people ask like what to do with downtime, and my answer is to do UWorld. So if your whole rotation isn't going to be constantly like doing stuff. For internal medicine, for the first few hours of the day, you see patients and you present and you come up with plans for the patients. And then after you're done working with your team, you can either go to the library or help the resident do stuff. So in that time, when you have the choice to go to the library or help the resident do stuff, usually the resident will just let you go and do your thing and study because they understand what it's like to be a student. And in that time, just do UWorld. However, on OBGYN, it wasn't so clear. We didn't have a specific time when we were doing something and when we weren't doing something. So on labor and delivery floor, they're constantly ladies giving birth. So you can't just, sit down and do UWorld for an hour and know for sure you're not going to miss anything important. It's not going to work like that. So for OBGYN, you kind of have to be a little bit more cautious about what you do out in the open. If you're just sitting there and doing UWorld, it's not going to look good, but it's not necessarily going to look bad. If nobody really cares, because the residents, they don't always kind of look at you all the time. If you're just sitting there doing your work, they won't say anything to you. But if you are only doing that, it'll look really bad. So a good way to avoid looking really bad is to to know that you are performing well on at least 60% of the patient interactions that you have. So if you're like patient interactions, presenting to attendings, and you know that at least a few attendings and residents have good things to say about you. Like if they were asked by your clerkship director, tell me about this student, then they're going to be able to say like really good things about you solidly, despite the fact that you sit there and do UWorld sometimes. So kind of play it by ear and use your best judgment. And with that, hopefully that answers like some of your questions or worries about the start of your rotations. And I just want to tell you guys, don't worry, relax. Everything is going to be okay. Just, just show up. Don't be annoying. You'll be fine. And hopefully the next videos that I make can help you with actual specific pieces of knowledge. And after that, the very last thing I want to leave you guys with is this quote by Woody Allen that I remembered a long time ago, and I just Googled to look up again. It's 80% of success is showing up. And to me, that's true. Like there are a lot of days that I just don't feel like coming in, and feeling tired, I didn't get enough sleep, whatever. Just come in. Just come in, just sit there. You don't have to do much throughout the day. You're going to learn a lot just from sitting there. So don't worry. Everything is going to be okay. You'll have your moments to shine, and you'll have down moments, and that's okay. All right, guys, good luck.